Later that day, the FDA came another raid, more patient documents, more subpoenas.
We were flooded with calls last Friday with people wanting to know how to get a hold of you. They're going to see this story this morning, see that you've been raided by the FDA, and they're going to want to know if you're for real or if the concerns of the FDA may have something to do with your treatments and the viability of your treatments.
Well, I don't think, let me jump in here. I don't think there's really an issue, as I mentioned, regarding the safety of the drug, and the FDA isn't contending at this point that the drug doesn't work. The only issue is that, according to the FDA, it has not been proven by controlled clinical trials. So, at least in terms of safety, the FDA isn't saying that it's not safe, and the FDA isn't even saying that it doesn't work. Right now, they're just contesting, or apparently they're contesting, whether Dr. Brzezinski himself has been shipping the medicine out of state, which in some respects is quite ridiculous since he has approval to ship the medicine out of state to various cancer institutions around the country. He ships it out of the country to various countries because it's being used in other places, and he ships it to individuals who have been granted permission by the FDA to receive the medicine under what's called a compassionate use INDs.
Okay.
May, June, and July, more witnesses testified before the grand jury, more documents. So we've had now 4, 5, or 6 grand juries. Let me talk about the subpoena practices. Most recently, the FDA has now subpoenaed the medical records of every patient who has gone on TV and told their story about Dr. Brzezinski. We'll let the committee judge what they think of that. We talk about dissemination of false information by the FDA. 1985, FDA tells anyone who calls and inquiring about Dr. Brzezinski that he's being criminally investigated. When the judge on the case found out about that, he issued a cease and desist and a strong reprimand against that. The FDA now has refined this tactic. Instead of waiting for people to call up the FDA, what they've done is subpoena all the records from Dr. Brzezinski about his business associates and all the researchers around the world, and there are many of them who are researching anti-neoplastons, his therapy. Now what they're doing is systematically contacting everyone who does business with him, who may do business with him, and telling about the grand jury investigation, subpoenaing documents. I believe that they're doing this in order to make the FDA, to make it more difficult for him to do business. I'd like the following questions to be asked the FDA. How much money have they spent in the last 10 years to try to put Dr. Brzezinski out of business? How many documents can they subpoena, and how many more grand juries does he have to go to? And why can't patients who have advanced cancer seek the medical treatment of their choice?
Upon the commencement of the FDA's 1995 grand jury against Dr. Brzezinski, an oversight and investigation subcommittee was organized by Congressman Joe Barton in an attempt to intervene in the FDA's relentless harassment of Dr. Brzezinski and his patients.
In my opinion, you have every right to use the investigative authority and the judicial resources of the federal government through the Justice Department to convene a grand jury. That's very appropriate. The first time, perhaps even the second time. It becomes questionable the third time, the fourth time, and the fifth time. It is not, I think, an unlogical conclusion to think that the FDA has a vendetta against Dr. Brzezinski or wants to retaliate for some reason. Now, that's my opinion. How many grand jury investigations have to occur that result in no finding of fault before you, as commissioner of the FDA, would encourage those within your organization to cease and desist?
Mr. Chairman, how do you know that there were no findings of fault that were returned from that grand jury?
There have been no indictments returned.
Mr. Chairman, I asked counsel to comment, but I don't think those are the same. As a matter of law, those are the same things.
I'm baffled by the splitting of hairs here, but
I'm just trying to understand the exchange between the witness and the chairman. What I understood the chairman to say is that there have been 4 grand juries convened?
At least 4.
I just am left then with a rather strong inference that if you convene 4 separate grand juries and there's no indictment returned, notwithstanding the prosecutors tell us always that it's possible to indict a ham sandwich, that probably there's not much there.
Dozens of Dr. Brzezinski's patients who had traveled to Washington, D.C. from all corners of the United States stood up and expressed their outrage with the FDA and Commissioner David Kessler.
The FDA has made a list and decided who can live and who will die. I guess I didn't make that list.
I've had no chemotherapy. I've had no radiation. I chose Dr. Brzezinski instead after a lot of research and a lot of searching. I've been in remission since 1989. Dr. Kessler, I'm not a statistic.
We're frustrated that our rights, constitutional rights, have been violated. This has got to end. My children are asking me, Daddy, what does the future hold? My one daughter wrote a letter to the president of this country and said, please don't pull the plug on my daddy. And that just broke my heart and broke my wife's heart.
My husband is a walking miracle. 16 months ago, the doctors told us there's nothing else they can do, and they told us to enjoy what little life he has left. Look at him. He biked 32 miles after being on Dr. Brzezinski's treatment for 2 months, and they're saying we can't have it?
I have a report from my family physician which tells how well I am doing. My tumors are leaving my body, and my condition is improving every day. Now the FDA is saying to me, no, your doctor is a criminal, he should be put in jail, and he needs to be shut down. This is criminal. I want the FDA to get out of our lives and stay out of her doctor-patient relationship.
What the classical conventional medicine had to do for me was there, nothing. For me, the next thing was the minister. I did not want to undergo chemotherapy, which I had a new name for, chemotherapy, or any type of radiation. I was extremely lucky I found Dr. Brzezinski. And I don't want the FDA to take this right from me. I came 18 years ago from communist Romania, and the tyrannous dictator Ceausescu never stopped a doctor from treating anybody. How can we have something like this in the United States?
Barely a week after these hearings, on November 20th, 1995, Dr. Stanislaw Brzezinski was indicted. Brzezinski was charged with 75 counts of violating federal law and fraud. If convicted, Brzezinski would face a maximum of 290 years in a federal prison and $18.5 million in fines. Not to mention what would happen to his patients.
He is their last chance for life, but now the federal government is issuing a death sentence for the patients of this cancer doctor.
On February 9th, Houston federal court judge Sim Lake ruled Dr. Brzezinski's treatments have been, quote, illegal under Texas and federal law since 1984, and he ordered them stopped on all but a handful of patients. Then he put a stay on his own order, a stay of execution.
I believe that most of these 300 people will die within a short period of time if the treatment is stopped.
In 1996, not only did scores of Dr. Brzezinski's patients return to Washington, D.C. to protest his indictment, but many of them testified again before another congressional hearing headed by Congressman Joe Barton.
Our first witness is Marianne Canary, is that correct?
Yes, that's correct.
From Aurora, Minnesota.
This is Dustin Canary, and he is on Dr. Brzezinski's anti-neoplastic treatment. This is my husband, Jack Canary. Now, in February of 1994, our lives were drastically changed. My son, Dustin, was only 2.5 years old at the time. He was diagnosed with a brain tumor the size of a golf ball. The surgeon removed 75% of his tumor, and the remaining 25% was diagnosed from a biopsy as a malignant, very aggressive medulloblastoma brain tumor, one of the most deadly forms of brain cancer. The doctors told us Dustin had only a few months to live. The first treatment offered us was radiation. But the radiation doctor told us that at his young age, Dustin would become a vegetable, and it would only extend his life for maybe a few months. The next doctor wanted us to enroll Dustin in a experimental chemotherapy, which was highly toxic. The side effects would include hearing loss, kidney and liver damage, bladder, stunted growth, and a possible leukemia. One question I would like to ask is, would you do that to your child? We weighed the harm these experimental drugs would cause against the fact that they would not cure Dustin, and decided not to subject him to these drastic measures. But our oncologists told us that their opinion took precedence over us as parents. This put added stress to the already stressful situation we were in. In April of 1994, we visited Dr. Stanislaw Brzezinski in Houston. Dr. Brzezinski made us no promises, but said that he often had very good results with brain tumors. At worst, it would not hurt Dustin, and it offered the best hope and a longer quality of life. An MRI 6 weeks after we started Dr. Brzezinski's treatment revealed no tumor. We were very overjoyed. Dustin continued anti-neoplastin therapy, and 1 year later, a tumor 1 inch by 1 inch in size was found on the MRI. That would be April of 1995. Dr. Brzezinski immediately raised Dustin's dose of anti-neoplastins. There were still no harsh side effects at all. The next MRI in September of 1995 revealed that the tumor had almost disappeared again. To this day, it has not reappeared. If you look at Dustin right now, he is a happy, healthy 4-year-old who has outlived his prognosis. There is no traditional treatment that would have kept him alive with such good quality of life. FDA Commissioner David Kessler loves to grab headlines as a man who loves children so much. He wants to protect them from the ravages of smoking. If Dr. Kessler loves children so much, why have he and his agencies been trying so hard to cut off my son's last hope for life? Without this treatment, my son will die.
This is a photo of Dustin Canary at 4 years old in 1996. This is a photo of Dustin Canary at 18 years old in 2009, and his brain cancer never returned.
In 1996, because of pressure from the politicians and American opinion, FDA agreed to accept all of the patients whom we have at the time to the program of phase 2 clinical trials. Basically, we filed and received permission to proceed from FDA for 72 different phase 2 clinical trials, which covered practically any type of cancer. This was such a tremendous work that basically it was necessary for me to work almost around the clock with 6 secretaries who were typing different protocols, and later I learned that FDA created a special task force to be able to review these protocols. We have sarcoma, soft tissue sarcoma, there's a special protocol for that. We have breast cancer, special protocol. For lung cancer, a few different protocols. For brain tumors, about over 20 different protocols for different types of brain tumors.
So, just a year before his trial facing life in prison, the Food and Drug Administration had finally authorized the very thing that Dr. Brzezinski and his patients had ever wanted. Even still, the FDA would not back down in making sure Brzezinski's trial moved forward. Federal prosecutors concede that a cancer doctor they will put on trial here in January for using an innovative but unapproved drug has been saving lives. The prosecution marks the first time the FDA has tried to jail a scientist for using a drug on which he is conducting FDA-authorized clinical trials. In a pretrial motion, Assistant U.S. Attorney Mike Clark objected to a defense request for the jury to visit the chemical plant where Dr. Brzezinski manufactures antineoplaston. The jury visit request is a thinly veiled effort to expose the jury to the specter of Dr. Brzezinski in his act of saving lives. Whether antineoplaston does or does not work is not an issue, and the jury should not be asked to decide the question. He added that if the issue comes up at trial, it would be an irrelevant, emotional, prejudicial, and misleading concern.
The issue of whether antineoplastons work may not even come up during the trial. The judge says that's not relevant, but the defense contends that's exactly the point, that what was done in developing the drug and administering it was done to save lives.
This trial cost the American taxpayer $60 million, while costing Dr. Brzezinski over $2.2 million. $700,000 of Brzezinski's legal defense was raised primarily by Dr. Julian Whitaker through his newsletter, Health and Healing. After Dr. Whitaker wrote of the plight and injustice being done to Dr. Brzezinski, his readers sent in close to 18,000 checks in small donations for Brzezinski's legal defense.
The trial is expected to last about 2 months. The jury will then decide whether Brzezinski is a fraud or a medical pioneer.
On March 4th, 1997, due to a deadlocked jury, the judge declared a mistrial. And after saying the government had not presented sufficient evidence, he ordered that Dr. Brzezinski be acquitted of nearly half of the 75 counts.
You voted to acquit?
To acquit, absolutely.
Not guilty.
Not guilty.
I voted for acquittal. I voted my mind and my heart. I do not believe that Dr. Brzezinski is a criminal. And I had voted to acquit.
But the FDA was still not backing down. They took Dr. Brzezinski to trial again. Though, after apparently accepting the absurdity of their case, on May 19th, the FDA suddenly dropped 40 of the 41 remaining charges. The FDA's facade in trying to convince the world that Brzezinski was a criminal was completely unraveling. Even the jurors who voted not guilty in the first case took time off of work to join the patient's protest in front of the courthouse during the second case.
I am appalled at the Food and Drug Administration and their actions.
We're here today basically to protest the witch hunt that's going on by the FDA.
We have to stick together and really support these patients that are suffering, not only health-wise, but having to come down here to make a stand against the FDA.
Please don't waste my money abusing the system to make sure that you maintain your power.
The jury spent about 3 hours deliberating this house of cards, leaving Brzezinski acquitted of the final charge.
Every one of Dr. Brzezinski's patients now, every future Brzezinski patient is and will be on a clinical trial.
There are many patients who would like to testify in our behalf and convince the jury and the judge that without the treatment they will die. But the judge did not admit any statements which could show that the treatment is effective. The judge did not allow the jury to visit our facility where we produce medicine. They were trying to keep it away from the jury. If this information will be presented to the jurors, then this trial would be finished very quickly. And that's what the jurors told us, because after the trial we talked to the jurors, And they were shocked that such information about the treatment, which is saving the life of a patient, was not presented to them. And I was sick listening to the lies of prosecutors from U.S. attorneys. It was not necessary for them to do it. They could tell the truth. They represented the biggest power, but they still were doing this all the time. So they were trying to do it a sneaky way. And that's what is horrible, okay? That's what should be exposed, because I think the United States deserves better.
While all of this was taking place, Brzezinski knew that the easiest way to keep the government from putting him out of business or in prison was to partner with an established pharmaceutical company. An interest was shown from Japanese pharmaceutical company Chugai and the Italian pharmaceutical company Sigma Tau, but both deals eventually evaporated, likely due to the rapport developed so far between antineoplastons and the FDA, being an issue indeed, and were unable to verify the likelihood that they could openly and effectively work with the FDA. Then, by 1990, it seemed that Brzezinski's luck had finally changed. Brzezinski had apparently treated the sister-in-law of the chairman and CEO of Elan Pharmaceuticals. Elan enthusiastically drafted a letter of intent stating they would aggressively pursue the filing of necessary protocols with the Food and Drug Administration for approval and marketing of antineoplastons as quickly as possible. They soon negotiated financing, licensing agreements, and royalties. In the midst of closing this deal with Elan, more good news emerged. Dr. Davorit Samid, a scientist and medical professor from Maryland who Brzezinski had hired to further study antineoplastons, managed to present her work at an oncology symposium in Switzerland, which landed her and antineoplastons a cover story in a 1990 issue of Oncology News.
In 1989, we retained Dr. Davorit Samid as our consultant. Dr. Samid at that time worked at Uniformed Services Medical School in Baltimore, and later she moved to the National Cancer Institute. She did a lot of work with antineoplaston ingredients. Unfortunately, when the pharmaceutical company entered the picture, such as Elan Pharmaceutical, our consultant, Dr. Samid, became too close. She really became consultant for Elan Pharmaceutical, and she was working with Elan from this time.
And suddenly, Elan Pharmaceuticals terminated their licensing agreement, stating Elan has significant doubt as to whether the active substances comprising of antineoplastons have patent protection, thereby rendering an agreement meaningless.
Antineoplastons are not just one chemical. You have different ingredients in antineoplastons, okay? One of these ingredients was known, and before we discovered that this is a metabolite of antineoplaston, and was known and was available before, okay? So when we patented our invention, our lawyers told us, look, you can't patent this particular ingredient because it was known before, okay? So let's list it in your patent, but don't patent this because you never get patent for that, okay? But this is the least important ingredient of antineoplastons.
While this was an odd turn of events, more good news continued to pour in. It was in October 1991 when Dr. Nicholas Petronas led the National Cancer Institute on their site visit, the very same site visit Dr. Petronas would later base his testimony when defending Brzezinski against the Texas Medical Board. This site visit not only confirmed that antineoplastons were curing what was previously considered incurable brain cancer, but it garnered their interest in conducting a confirmatory trial under Division of Cancer Treatment sponsorship at the National Cancer Institute. These trials involved most of their top experts, including Dr. Michael Friedman, the Associate Director of the Cancer Therapy Evaluation Program. In a memo addressed to his director, Dr. Friedman wrote, "I thought you would be interested in this. Antineoplastons deserve a closer look. It turns out that the agents are well-defined, pure chemical entities. The human brain tumor responses are real. The National Cancer Institute's decision network then convened and gave the green light to conduct government-sponsored clinical trials of anti-neoplastons.
Initially, everybody was very excited about it. Everybody would like to proceed. The people who reviewed our results, the experts from the NCI, they did a very good job. They were critical, of course, but they were also highly complimentary for the way we treat patients and the results we got. Okay, so it looks like everything should open and we move forward. Suddenly, everything came to the stop, and then we found that a few months later, Ilan received permission to do clinical trials with this particular ingredient. Okay, ours was pushed back for something like 4 years, and then Ilan was allowed to proceed with this one suddenly.
When Ilan terminated their business deal with Brzezinski, they went behind his back, recruited Dr. Davorit Samid, and partnered with the National Cancer Institute, where Dr. Samid soon became a section chief. Ilan then co-sponsored laboratory research and clinical trials testing only this single ingredient, called phenylacetate, the same chemical that Brzezinski was advised he couldn't patent, and had already proven to be quite limited against cancer as a single substance as far back as 1980.
After the treatment in a small number of patients, we found that the activity was quite limited. That's why we decided to abandon phenylacetate, and we use the other antineoplastons. One of them contained phenylacetate as the second ingredient. Phenylacetate alone has very small activity. It's not very effective.
In 1994, I started working for Davorit Samid. She didn't let me know that one of those compounds is from Brzezinski, Dr. Brzezinski. You know, it's just say phenylacetate and show me all the published paper about phenylacetate and its analogs and their anti-cancer activity. It was quite amazing in the lab, because if you find a compound that has anti-cancer activity and then you find a bunch of analogs, it's like you stumbled in a pile of gold. So people would think, hey, say, you know, patents, you know, that sort of thing. Davorit, under her leadership, we find a lot of biological activities of these compounds. So it would have anti-cancer activity. So the scientists at Johns Hopkins tried to patent these compounds. But of course, Davorit was working with Ilan Pharmaceutical Company at that time. So those guys at Johns Hopkins didn't have any chance of patenting those compounds. So, you know, but it's interesting that she would complain in the lab and saying that these guys, you know, it's trying to, you know, go behind her back and patent these compounds.
While Brzezinski was facing continuous harassment from state and federal agencies, the earliest phenylacetate studies were published in April of '92, authored by Davorit Samid, hosted by the National Cancer Institute. Brzezinski sat in awe as he witnessed the National Cancer Institute recruit one of his researchers, push his research aside, and begin to test phenylacetate without him, reporting, "Phenylacetate is both effective in inducing tumor cell maturation and free of cytotoxic and carcinogenic effects, a combination that warrants attention to its potential use in cancer intervention."
1995, you know, in the lab, I was still with Davorit, but I smell fishy. Something is not right. The first paper Davorit published about phenylacetate, if you look at the methodology section, there's the BRI abbreviation. She got materials from Brzezinski Research Institute, Houston, Texas, but it didn't say Brzezinski Research Institute. For us, as scientists, it's a funny practice.
Brzezinski's name failed to appear in the acknowledgments or any of the references listed in this report. Brzezinski knew these tests would fail, since he had already proven this in his own laboratory 12 years before. Abandoned by the National Cancer Institute, he sat powerless on the sidelines as the attempted hijacking of his discovery unfolded before his eyes, ending in the hideous train wreck he warned them it would. The National Cancer Institute, Ilan, and Dr. Samid spent over 4 years and tens of millions of dollars testing phenylacetate.
Phenylacetate really by itself has very little clinical effect.
And the NCI or Ilan could not use the other ingredients of angioplastin because they were covered by the patents owned by me. They were trying to commercialize this, but without the other ingredients, they couldn't do much with this. This needed to be given in conjunction with the others.
While coming to terms with this reality, the National Cancer Institute decided to honor the government-sponsored clinical trials of anti-neoplastons they had initially promised Brzezinski in 1991. From the moment this dialogue was reopened, the National Cancer Institute proposed altering the treatment protocols that Brzezinski had spent 20 years perfecting. Brzezinski told them that until they agree to a protocol that he has confidence in, he was not going to provide the National Cancer Institute with any anti-neoplastons. Dr. Michael Friedman told Brzezinski, in response to your correspondence, one last time, we will revise the protocol with regard to dose and schedule in compliance. However, if you are unable or unwilling to provide the anti-neoplastons in the near future, we will pursue alternative sources to procure the drug or its active components, and will proceed. Brzezinski responded, I appreciate very much that you have finally decided to follow my recommendation regarding dosage. But your final statements that you are ready to proceed with the treatment with anti-neoplastons without our participation caught me by surprise. It is hard to imagine that a federal employee would consider patent infringement. Placing these ominous threats from Michael Friedman aside, they finally managed to agree on a protocol. The protocol was simple. Patients with tumors larger than 5 centimeters, more than one tumor, or with metastasis are excluded. After everything was approved and Brzezinski released his medicine, a full year passes, in which time over 15,000 Americans had been diagnosed with the types of brain cancer this trial was focusing on. Yet, America's National Cancer Institute was somehow having difficulties in accruing patients. So, they used this as an excuse to go behind Brzezinski's back again and take it upon themselves to drastically alter the protocols. Dr. Friedman, it has been brought to my attention that the protocol has been amended to accept patients with tumors measuring over 5 centimeters, multiple tumors, or with metastasis. I am outraged that without my knowledge, Memorial Sloan Kettering Cancer Center, with NCI's permission, changed the protocol. Treatment of patients with these conditions will require a different protocol with a different schedule and different dosages. I hereby request that the amendments be canceled immediately and the original protocol be used as promised. The National Cancer Institute responds, sorry, but the amendments have been approved. Brzezinski fires back. Let me make perfectly clear that as the discoverer and developer of anti-neoplastons and the individual with nearly 20 years clinical experience using them, it is my professional opinion that the drugs will not produce substantial benefit in such advanced patients. As I have repeatedly informed you, the protocol that we are currently using for such advanced tumors requires doses 3 times greater than that currently being used.
These trials have been conducted at the Mayo Clinic in Minnesota and the Sloan Kettering Hospital in New York. Currently, there are only 8 patients enrolled.
I'm very dissatisfied with that because our desire is to achieve the proper enrollment in as quickly a manner as we can in order to really test this hypothesis.
Friedman blamed Brzezinski for this slow motion, saying Brzezinski restricted admissions to the trials too stringently. To speed things up, admission standards for the trials have been lowered to bring in patients in worse physical condition. This over Dr. Brzezinski's strenuous objections.
We got the idea that the main interest is to let this patient die rapidly and make sure that treatment will never work.
Dr. Brzezinski has threatened legal action to halt these new admissions, and NCI has suspended recruiting, leaving the trials with just those scientifically unsatisfactory 8 patients. Meanwhile, both the FDA and the Texas Medical Board are still trying to stop Brzezinski.
On May 8th of '95, less than 2 weeks before this broadcast, the National Cancer Institute issued an internal memo to all of those involved in the anti-neoplaston trials. For the record, the Clinical Trials Monitoring Service has been instructed not to send any anti-neoplastons clinical trial data to Dr. Brzezinski, the Brzezinski Research Institute, or anyone inquiring about the anti-neoplastons clinical trials. Any inquiries that may be related to the trials or Dr. Brzezinski are to be referred to the Associate Director, Dr. Michael Friedman. Friedman then taunts Brzezinski. I must convey my deep pessimism. We are in no way obligated to obtain your consent. Your insistence on dictating the manner in which we conduct or review these clinical trials is both presumptuous and inappropriate. The future of these trials rests entirely with the NCI, since our primary obligation is to the American public. Brzezinski responds, your letter of June 6 conveys pessimism? My letter conveys outrage. Patients were admitted against admission criteria, their treatment was discontinued, and their lives were jeopardized for frivolous reasons. In spite of your promise, we never received any detailed data on these patients. There must be a reason why you are afraid to provide us with complete copies of medical records. Well, there was a very good reason why Dr. Michael Friedman was afraid to provide Brzezinski with complete copies of these patients' medical records.
It took us at least half a year before we forced NCI to release some of this information to us. And then we found that they severely violated protocol. They did not comply at all with the protocol. On the top of that, patients were forced to stop the treatment with antioplastons because of massive fluid retention. And this is something which we don't see with antioplastons. Typical effect of antioplastons is dehydration, which means elimination of the fluids. The patients are losing a lot of fluids to the point that they have to drink a lot of extra fluid. We don't see increased fluid retention. I was curious why this could happen. I knew that the patients were receiving a lot of intravenous fluid, but then we learned that perhaps the fluid which they were receiving were not anti-neoplastons.
In October of 1995, the National Cancer Institute's Cancer Information Service issued a public statement for anyone inquiring about their clinical trials of anti-neoplastons. In it, they stated, because these studies were closed prior to completion, no conclusions can be made about the effectiveness or toxicity of anti-neoplastons. To their credit, and according to the scientific standards set by the National Cancer Institute, this was indeed the truth. However, 4 years after these trials were closed, and 2 years after Brzezinski defeated the FDA and won his freedom, the National Cancer Institute just couldn't leave well enough alone and decided to vindictively publish these scientifically invalid anti-neoplaston trials in the peer-reviewed medical literature. In it, they described how 9 patients were treated, and no patient demonstrated tumor regression. However, whoever was responsible for publishing this report was apparently careless enough to also include the anti-neoplastons concentrations detected in the blood of the 9 patients during treatment.
We compared this to the data which we have in our studies. We found that they were severely diluting the medicine, and this was why the patient had fluid overload. Antineoplaston AS2-1 consists of 2 ingredients, which is called phenylacetate and phenylacetylglutamine, and about 2.7 times lower level of phenylacetate in patients' blood compared to what we see in our patients who receive successful treatment. Phenylacetylglutamine, there is about 36 times lower level in patients' blood compared to what we see in our patients receiving the right dosage of antineoplastons. And the concentrations of phenylacetyl isoglutamine, one of the main ingredients of antineoplaston A10, were close to 170 times lower than what we see in the treatment of patients with antineoplastons. And that's what we found from patients' husbands or patients themselves, okay? That's what they were doing, okay? So this was horrible, okay? This was like a criminal act, okay? They should be prosecuted for that, okay? Because obviously they knew what they were doing, and they knew that these patients have really no chance to respond to any treatment. They're going to die, okay? And that's what happened. After we realized what they do, we decided to force them to stop clinical trials. And since then, obviously, National Cancer Institute hates us, okay? They do whatever they can, obviously, do not cooperate with us anymore.
In the past, when NCI or its assigned entity conducting an alternative cancer therapies, they always alter the protocol and let it fail to discredit the therapy. But this time, the pharmacokinetic data shows that they didn't do it right. And most scientists would not look at it carefully because Papa is telling you something and you don't question him.
Most of us would assume that with any story such as this, surely there's another side to it. Our story is no exception. After the National Cancer Institute intentionally violated all protocols of their own anti-neoplaston trials, and after all state and federal agencies had failed in their 14-year campaign to remove Brzezinski from society, after all of the dust settled, a profound truth began to emerge. It was October 4th, 1991, that America's National Cancer Institute hosted their site visit to Brzezinski's clinic and verified for themselves that anti-tumor activity was documented by the use of anti-neoplastons. 17 days later, on October 21st, 1991, the United States of America, as represented by the Department of Health and Human Services, and Dr. Davorit Samid filed a patent for anti-neoplastons AS2-1. They even had the audacity to include Brzezinski as a reference. The invention described herein may be manufactured, used, and licensed by or for the government for governmental purposes. At the time, Brzezinski had no idea this had happened, but did have his suspicions when they began to openly test phenylacetate without him, and the National Cancer Institute knew it. In an April '93 NCI memo distributed to those involved with Brzezinski, they state their concerns. Political issues are a real concern. Congressman Bedell is concerned we are taking the anti-neoplastons away from Brzezinski. Brzezinski has patent on anti-neoplastons. Since phenylacetic acid, or phenylacetate, may be the active component in anti-neoplastons, our involvement has become an issue. 5 months later, the United States of America and Dr. Dvorak Samid file their second extended patent on anti-neoplastons. And guess who else was in it? In March of the following year, America files its most extensive updated anti-neoplaston patent to date, spanning 111 pages. 7 months later, they file a fourth one. June 6, 1995, the United States government has a field day filing their 5th, 6th, 7th, and 8th extended patent on anti-neoplastons. The following day, America files its 9th, 10th, and 11th extended anti-neoplaston patent. And a couple of months after the 11th patent was filed, Dr. Michael Friedman leaves his position at the National Cancer Institute and becomes Deputy Commissioner of Operations for the Food and Drug Administration, working directly under Dr. David Kessler. And by November of that year, after a decade of failed grand juries, the United States of America's Food and Drug Administration finally manages to indict Dr. Brzezinski. 1 month into America's criminal trial against Brzezinski, America's first patent on anti-neoplaston AS2-1 is approved. A month after America fails in their second trial against Brzezinski, their second and third anti-neoplaston patents are approved. Over the course of the next 3 years, the United States Patent Office approves all 11 copycat patents on anti-neoplastons AS2-1.
And as we know, all of this was done based on the fact that the United States, which is National Institute of Health, together with pharmaceutical company, which is Elan Pharmaceuticals, was trying simply to steal my invention. That's what they wanted, okay? It's not that we had successful visit from the National Cancer Institute in which they determined that this treatment works great, and they decided that we should go through phase 2 clinical trials, which will be sponsored by them. No, this gave the idea of some higher-ups to FDA to conspire with pharmaceutical company so that they can steal the invention from me and get it because it was good, okay? So that's the whole story, okay? And they knew that if I be still free, they won't be able to do it. Because they knew that if I would sue them, they would have a chance in court because we have our patents before, okay? So that's why the attempts from them to wipe me out financially, to put me to prison, to attack me from every possible angle, FDA, which is federal government, state government, to be able to steal my invention, okay? That's the real thing from the National Cancer Institute and Elan Pharmaceutical. They failed. We survived and we moved forward.
These patents are full of useful information. Aside from noticing their blatant infringement, compositions and methods for treating and preventing cancer using the distribution of anti-neoplastons AS2-1's ingredients, they enthusiastically state the neoplastic conditions treatable by this method include neuroblastoma, leukemia, myelodysplasia, acute glioma, prostate cancer, breast cancer, melanoma, lung cancer, medulloblastoma, and lymphoma, to name a few. They also point out how anti-neoplastons can also be used as a cancer preventative. However, the most revealing piece of information found in these patents is where they state current approaches to combat cancer rely primarily on the use of chemicals and radiation, which are themselves carcinogenic and may promote recurrences and the development of metastatic disease. Let's read that one again, shall we? Current approaches to combat cancer rely primarily on the use of chemicals and radiation, which are themselves carcinogenic and may promote recurrences and the development of metastatic disease.
Now, how could the U.S. Patent Office be corrupted to the point that they issue patents on medical therapies that had already been patented and issue them to someone who had nothing to do with their discovery or use? How could that happen? And how can the patent office then assign these fraudulent patents to some of the most powerful institutions in American government? And imagine, all of this was being done while these same government agencies were spending millions of taxpayers' dollars trying to put Dr. Brzezinski in jail so that he could not fight the criminal theft of his discovery.
They in some time have a creed. It's to separate the medicine from the medicine man. And of course, these higher up at NCI or whatever, they think, hey guys, we have been doing this for years. We know what's going on. So they think, well, we know what's going on with phenylacetate, phenylacetylglutamine. If you can outsmart the medicine man, you can cut a piece of a pie for yourself. That's the name of the game. If you cannot be the first one, if you can the second one and be bigger than the first one, still, why not? That's the mentality. You know, under the capitalist sun, there's nothing sacred. Money talks.
The smearing campaign against us continues from good doctors, from American Medical Association, from American Cancer Society, despite of the fact that it should stop a long time ago.
True progress in medicine has always, without exception, been violently resisted by medical authorities who cling to the beliefs of their time. In 1840, Ignaz Semmelweis, an Austrian obstetrician, noted that over 20%, that's 1 out of 5, women giving birth in the hospital died 4 to 6 days later of puerperal fever. These women were then autopsied in the basement of the hospital. And the doctors who performed these autopsies wore no gloves. Can you imagine that? Believe it or not, they then would leave the autopsy room and go straight to the delivery room to assist other births without even washing their hands. Then Dr. Semmelweis's good friend and fellow physician accidentally cut his finger while he was doing an autopsy. In 6 days, this doctor died with the same signs and symptoms of puerperal fever. All of a sudden, Semmelweis knew. He realized that the doctors were transferring the disease from the autopsy room to the delivery room, and he urged his colleagues to simply wash their hands. For this unforgivable sacrilege, he was drummed out of the medical profession, and he died in an insane asylum. Now today, we have the same kind of arrogant commitment to belief. But with cancer treatment, we have a $1 trillion business built on those beliefs. So if you think Semmelweis had a problem, just imagine the problem Dr. Brzezinski faces. There was no money involved in hand washing versus non-hand washing.
The fact that we are permitted to enter phase 3 trials means that the treatment shows already safety and efficacy in phase 2 trials. This means that at this moment we should receive overwhelming support instead of being harassed as we are so far.